Welcome to the Field Notes podcast, presented by Seaworthy Functional Medicine. Seaworthy exists to help you overcome your complex health challenges, so you can be fully vital. Now, here's your host, Heather Moon.
Welcome back to the Field Notes podcast. Today we're diving into a topic that deserves far more compassion, nuance, and conversation than it often receives: the topic of eating disorders. In the world of functional medicine, we talk a lot about root causes, but eating disorders remind us that healing is never just physical. It's emotional, neurological, relational, cultural, and deeply human. This conversation is not about willpower or appearance. It's about understanding the complex relationship between the mind, the body, nourishment, identity, and control. Whether you've personally struggled, supported someone who has, or simply want to better understand the landscape of healing, my hope is that today's conversation brings insight, empathy, and hope. And we're joined today by Jenny Loudon, one of the co-founders of the Alaska Eating Disorders Alliance. And I thank you, Jenny, and our audience for being here today. Welcome.
Yeah, thank you. It's wonderful to be here.
Yeah. I'd really like to start with getting to know you and helping the audience get to know you a little bit and just talk about what brought you to wanting to work with individuals with eating disorders. And I'd love to just share with the audience the story of the founding of Alaska Eating Disorders Alliance.
Yeah, so the story of how the organization started is fairly interesting. It was founded by myself and my colleague Beth Rose. Both Beth and I had known each other for 20 years, 15 years, and had been in a book club together. And
Mhm.
so we would see each other every month and we'd talk about books and ideas and we were friendly and knew each other. What we didn't know is that at the same time we were both supporting loved ones with very severe eating disorders, because we don't talk about them. You know, when someone is struggling, we don't always know how to share that with others and when it's safe to do so. And so later into this, we found out that we were both simultaneously trying to figure this out on our own as and walking parallel paths. And when we figured that out, we thought, my goodness, you mean this whole time we could have been supporting each other and sharing information and sharing knowledge, so that we weren't walking on the journey by ourselves. And so when we started to realize this, we came together and we said, we actually have skills. I have a background in public administration, with an emphasis in health policy. Beth's background is in nonprofit management, development, community outreach. And we're like, okay, I think we actually have some skills and we definitely have the passion to want to make a difference in our state. So we came together really with the idea that we could start an organization so that others would not have to walk this path alone. And so now we've been around since 2019. And when you even just mention 2019, people know what's coming next, which is 2020, and the pandemic. And what we saw is that, during 2020, during the pandemic, eating disorders spiked incredibly high. The numbers of people with eating disorders, as well as the severity of the eating disorders, both of them really raised up very quickly. And so we came to, it was just the perfect timing for this organization to need to be here.
Right. Wow. It's really great that you guys opened up to one another and that the conversations eventually led to that. You mentioned not walking the path alone, and that's really important. And it also brings to mind just the observation that I've had that not only is the person who's experiencing the eating disorder going through it, but their family and loved ones are also going through it and they need support too.
Absolutely. And families are a main part of the treatment, especially if you have an adolescent. Um, you really need to have families who are involved and helping and
Mhm.
helping refeed that child, and oftentimes, and providing structure to help to eliminate or lessen eating disorder behaviors. And so helping those parents with these skills, they're different skills than we would utilize or need to know if you didn't have a child with an eating disorder. But if you do, you really need to learn these skills, and there weren't a lot of places to learn these skills locally at that time.
Wow. Wow. and especially in a place like Alaska where we're just so far removed from recovery facilities.
Yes,
I don't believe we have an inpatient recovery facility at all here, correct?
we do not. No.
Oh, okay. Yeah. It's hard to facilitate getting out of state. And then if the individual's removed from their family, that just makes things, it
Yes.
seems like that just compounds the issue.
It really does. It can be traumatic to have to leave and go th thousands of miles away. And it's if you're a child or an adolescent, that can be very traumatic. Oftentimes, like people haven't even left to go to like sleepaway camp before, and now
Right.
all of a sudden they're living, in a residential facility thousands of miles away. And if you're an adult, that means that you've got to really stop your life,
Right.
leave children if you have kids, behind potentially, and put a halt on your job and all of the things in order to leave the state for months at a time in order to get what's life-saving treatment.
Right. Yeah. Fairly upsetting, but very important. I think I
Yes.
got ahead of us a little bit, so I think it would be really important just to educate the audience. Anybody who might be wondering, what does it mean when we say somebody has an eating disorder?
Yeah, it's great to go back to the beginning. Really, eating disorders, the definition really is that they are serious but treatable, and that treatable part is really important. They're
Yeah.
serious, but they are treatable. They're both a mental illness as well as a physical illness. And all eating disorder types have severe, persistent, disturbing disturbances in eating behaviors. It's often, but not always, driven by a fixation on weight or body or shape or food intake. There are actually 8 different types of eating disorders that are listed within the Diagnostic Statistical Manual. And we don't have to talk about all of them, but just know there are these 8 different types, and often they basically include various levels of either food restriction or binging and purging. And so, the classic restrictive eating disorders, anorexia nervosa, where you have that severe food restriction. And really what it means is that you're taking in less nutrients and energy than your body has need for. Just sitting here right now, we may not be exercising, but our body has food nutrient requirements. And so the amount of food and nutrients being taken in is not sufficient for the body to be able to keep up. The different ways that this can happen, sometimes it's by eating less, sometimes it can also include exercising more, or purging food. And with anorexia, the classic anorexia nervosa is that you will be severely underweight, but still just not recognize that that this is true. And so you have this distorted body image. You might look at yourself in the mirror and think, I'm fat, or I don't look good, even though anyone else looking at you would say that is just clearly not true. I do want to just mention with anorexia that most people who have anorexia have a type of anorexia called atypical anorexia. And so there's anorexia nervosa, and then there's atypical anorexia nervosa. And those who have atypical anorexia will have all of the same thoughts and behaviors around food. They're going to severely restrict food, and have that distorted image of themselves. But the only difference is that they will not necessarily be at a very severely underweight body weight category. And in fact, they don't have to be considered like underweight at all.
Okay.
And this is a really important thing because I think a lot of people don't recognize that this can be the case. And in fact, it's more common than not that you won't be able to look at the person and just know by looking at them that they have anorexia. And it's really important for people to know, even if you're not severely underweight, that food restriction in and of itself causes a lot of harm. It causes a lot of physical challenges and medical instability. And so it's very, very dangerous, life-threatening, even if you're not severely underweight.
I
Um,
appreciate you sharing that. It's important, I think, for everyone to be aware of, and I don't think it's just commonly understood.
it's not commonly understood. And then the other big ones that people understand and usually know about with eating disorders include bulimia
Mhm.
nervosa, where someone will generally eat larger amounts of food at one time, so they're binging. And then over time, they feel shame about that food, and they go to extraordinary efforts to try to get rid of it. And that can be through vomiting, fasting later, using laxatives, even over exercise can be considered a type of purging, of trying to get rid of nutrients that they took in. And then there's binge eating disorder, and binge eating disorder is the most common eating disorder of all. And it is basically like bulimia, in terms of someone who's regularly eating a lot of food over a short period of time, often in silence or in by themselves, often with a lot of shame, a lot of physical discomfort, maybe eating to past the point of feeling comfortable. But then they don't, and one of the key things is they often feel that they're out of control, so that they feel like they can't stop. Um, it's just not followed by the purge, which we would see with somebody with bulimia. So those are the three big types of eating disorders, and then there's a whole bunch of others that are less common.
All right. Thanks for highlighting those. I really appreciate it. And
Yeah.
it definitely is a bigger topic, and there's a lot more to it than certainly we have time to cover today, and really that I think most people realize.
Yes.
Yeah. Um, there's eating disorders and then there's disordered eating. Is there a difference? And if so, what would you say? What's the difference there?
Yeah. So when I think of eating, I think of eating as being on a spectrum. And
Mhm.
so on one end of the spectrum, we have what we might call healthy eating. And if you are a healthy eater, you are able to do things like eat when you're hungry, stop when you're full, um, enjoy a wide variety of foods, without feeling a lot of shame. You're able to um, understand that food provides a lot of things for us, nutrients, but also pleasure. You're able to like go to the birthday party and say, "Yeah, I'm going to eat that piece of cake at the birthday party." So, you're able to just take enjoyment from food and eating this wide variety. If I were to ask how many people in a room consider themselves having 100% of their life feeling like a normal eater, very few people feel, are just in that space and stay in that space throughout their life. So a lot of people, most people, in fact, have experienced some amount of disordered eating. So if normal eating is on one end of the spectrum, and then an eating disorder that's, this clinically definable eating disorder is on the far other end of the spectrum, I consider disordered eating everything kind of in between. So that might include things like um, yo-yo dieting, um, feeling that kind of that weight cycling where you're gaining weight, losing weight, gaining weight, losing weight, or feeling like, oh, I can't go and allow myself to eat that meal because I didn't exercise this morning, or something of those natures. So there can be a lot of this disordered um, behaviors or thoughts around food that are in the middle, even if you don't necessarily meet that, clinical definition of an eating disorder. But what I also like to tell people is that if you experience disordered eating, you are at higher risk for the development of an eating disorder. There's nothing magical about like that line of where the clinical diagnosis begins. If you are experiencing disordered eating, it can be very, very traumatic. It can be taking away a lot of joy from your life. It can be taking a lot of, the real estate in your mind that you're spending thinking about food or your body or exercise, all these different kinds of things. And a lot of times people with disordered eating, I encourage them to say like, well, even if you don't have an eating disorder, you deserve to get help, and you deserve to start thinking about your relationship to food and body, and how do you want your relationship to be? How can you move closer on that spectrum back towards that normal eater who's able to enjoy food and eat when you're hungry, stop when you're full.
Yeah. I share with a lot of folks that I speak with who are just really wrestling with how to eat right, how to eat well, how to
Yes,
eat enough, what is right, what's true. It really occupies a lot of their brain space, and I feel like that's really sad. And it's something we're born knowing that when we're hungry, we cry, and then we eat until we're full, and then somewhere along the way that
that's
gets
right.
overridden, and it can get overridden in a number of ways. And so I just really try to encourage folks to understand that's not their fault.
It's not their fault, but they can help make it but change is available. It's not your fault and you can be the solution.
Right.
And there are solutions available to try to heal that relationship with food,
Yeah.
or heal that relationship with your body so that you are at peace. And recognize, and that it's not something that is then just taking up so much time in your head and causing so many negative feelings, and emotions. Just think about all the things we'd be able to do in the world if we weren't spending so much of our time thinking about food and body.
Right. Yeah. It frees up a lot of mental space and energy.
Yep, exactly. For
Yeah.
joy, for
Yeah.
for doing the other things that bring you joy, and making that life worth living.
I really appreciate that you circled around a couple times now about like it is possible to get help. It is possible
Yes.
to treat this. Treatment options are available. I definitely want to explore some potential treatment options here in Alaska and also elsewhere if someone is interested. Um,
Yes.
I think a really prominent cause of, or maybe a driver of disordered eating has to do with social media and culture. And so, what advice do you have for people who are really just trying to find they're just really trying to find the right person with the right message for them. Like, who are they supposed to listen to and what are they supposed to believe?
Excellent question. There's a lot of research actually happening on to try to answer that with real science. And
Okay.
one of the things that people are finding is that how important it is to do an audit of your social media and to
Okay.
recognize that there's not just like one single right, true way of eating or doing these things. We want to think like, oh, there's one path, and if I just get it right, everything will be okay. But what if we said there's a variety of ways of being right, and also of knowing like sometimes it's okay if we eat quote unquote wrong, like so some days we might eat more than we really need our body needed. And what if we gave ourselves compassion about that? And what if instead of just, beating ourselves up about that, we just, we do the best that we can, but we hold the kind of some flexibility in our minds. And so one of the things with social media that people have found that the research is really clear is that it can be really helpful to kind of go through your social media and look and see like, okay, when I see these posts, does it actually make me feel better?
Hmm.
And if it's not, I probably should stop following them. And so really going through and being with a critical eye to say like, okay, is this something that is actually helpful to me, or is this just causing me to feel less and less flexible, more and more inflexible, that there's only one right way to do these things?
Hmm.
And consistently go through and unfollow people. In addition, it can be really helpful in a social media feed to make sure, like, if you look at your feed and everybody looks the same way, it's probably not going to be helpful for you. There's a lot of body types, and there's a lot of people with different bodies that can all be healthy, and there's a lot of ways to exist in this world. And the size of your body, is caused by a variety of things. And so, if you have a feed that only highlights one certain body type, that may or may not be attainable for you. And it also may cause you a lot of stress to be constantly feeling like this is how I must look all the time. And so having a feed that shows like a wide variety of body types,
Hmm.
can be really important and helpful for people to recognize that there are just a lot of ways people can exist in this world and a lot of bodies in this
Yeah.
world, and not just a single body type that is, okay.
Yeah. We're all designed differently, and that's so beautiful.
That's exactly right. And so if your feed is making you feel that there's actually only one way to look, or there's only one body type that's acceptable, or one body type that now you must go and be spending all of your time trying to achieve, it's probably not very healthy. And so, recognizing and reminding yourself that actually there's a lot of happy people in a lot of different sizes and shapes and weights, can be a very, very freeing thing for people.
That's really helpful. I appreciate that tip. It's really great to know that there's some science going into it because there's just there's a lot of science behind our behavior. There's a lot of
That's right.
information behind like what drives us to click on like and what doesn't. And so it's great that research is happening. I have so many questions and so many things I would just love to discuss around this, just to offer some education to the audience and help out a little bit. I think it might be helpful to know some of the subtle signs of disordered eating that we may not always like. It may not always be a dramatic weight loss. It may not always be eating in secret or something like that. Like, what are some things that we don't necessarily think of that we might need to be looking out for?
Great question. So, if you start noticing that somebody has kind of changes in the way that they are interacting with food, um, or less flexibility with food, where there's fewer and fewer things that people feel are safe. Maybe will do things like cook a lot and make food for others, but then not partake in the food themselves. Um,
Mhm.
Sometimes folks will, some other signs people might notice are um, other behavioral types of things like becoming more isolated, not feeling like you can go out with friends because, well, they're going to a pizza party and I don't, I don't feel comfortable with that. So there's a lot of things that you can look for that are like how people are behaving and interacting with people. And then sometimes there are physical signs that somebody can see on a physical exam. Um, Things like hair sometimes will start to fall out or thin, if especially if you're not getting adequate nutrition. Um, there's lanugo hair that sometimes will grow on a person's body. And really, although we're not entirely sure the purpose of lanugo hair, there's a lot of belief that most likely it is just the body's attempt to try to stay warm and to try to regulate temperature when you're not getting enough nutrients. Sometimes people will have very cold extremities. So if you're doing a physical exam and someone has very, very cold like hands, a lot of times you can like do a physical exam and kind of feel your way up, and you can feel where the heart is just not able to pump out enough blood to keep the hands warm. And so it's at that point it's just shunting and saying, nope, I'm going to make sure that my central core organs are prioritized. And so I don't have enough nutrition in order to be able to put out blood all the way to all the extremities. So we're just prioritizing the core. That's what the heart is doing for you. So there are a wide variety of things that can be seen and felt on a in a in a physical exam, but there's also some more subtle cues, like I mentioned, of some of those behavioral changes that can also be a part of the whole picture.
Yeah, yeah, and having my own share of lived experience, I definitely think that mood changes are a really big part of that. Not only behavior changes, but changes in mood. If you're malnourished, you're
Absolutely.
going to be tired, you're going to be moody and emotional. But as a like it, for example, as a teenager, it's like, well, what part of that is a normal part of the teenage transitioning, and what
Totally.
that is this development of disordered eating.
Yes, I'm glad you brought up the mood changes because that is a clear sign, and and it is really important to note. Because malnutrition, we know you see, I mean, I don't know if you've ever studied the Minnesota starvation experiment, but
Mm.
it's a very famous experiment that happened during World War II where they actually took normal control men and they starved them for science. This would never get through, all of the things required for ethical studies at, now, but at the time, and that so they actually starved these men, and they basically what they saw is as the nutrition went down and down, that they started to show a lot of the signs that we see with people with anorexia nervosa or people who are not getting adequate nutrition. And so it is the malnutrition itself that causes those kinds of inflexible thinking, mood changes, really focusing on food more and more and more, just having this desire, even though they're malnourished. And so it is the malnourishment itself that can cause those behaviors.
Yeah. Wow.
Mhm.
Yeah. It must be hard to watch somebody going through that and hard to go through that too.
Absolutely. Yes. Yes.
Do you know what causes eating disorders? Is there a good understanding of that?
Yeah, it's a great question, because a lot of times people think that they know, but it is a much more complex, it's kind of the perfect storm of things that can come together. We
Mhm.
can consider them biopsychosocial disorders, and so that means that there's a biological piece, there's a like a psychological piece, and then there's also the social piece. And so from the biological piece, we know that there are genetic markers. There are things genetically that put somebody at higher risk genetically. And we see this over and over again. That sometimes eating disorders kind of run in families, not always, but it's not uncommon to see these, oh, my parent had an eating disorder, and then the child maybe, ends up with an eating disorder as well, because there are biological genetic things that put people at higher risk. And this includes like neurobiological predictors, with variations in like neurotransmitters and the brain reward circuits in the brain. Um, in terms of the psychological pieces, we know that there are also things that put you at higher risk, including some personality traits.
Hmm.
So things like perfectionism, um, harm avoidance. If you have some of these types of personality things that you're just born with, it does put you at higher risk. So if you're looking for that like perfect diet or the perfect body, all of those things can become, you're using that perfectionistic trait towards something that is basically fueling your eating disorder. And then in terms of the psychological, we also want to recognize that some people also have co-occurring mental health conditions that can put them at higher risk. Things like anxiety, depression, and OCD, in
Mhm.
particular, are very high comorbid um, predictors of eating disorders. And then in terms of the social piece, we talked a little bit about the social media and other
Yeah.
societal pressures to be thin or to have some unrealistic beauty standard or body standard. And those standards can change over time, and they might be different for men and women. So, but a lot of men also have these unrealistic standards for being ultra muscly or having certain body types that aren't necessarily realistic for most people. And so a lot of those things can put people at higher risk, those social things, including things like weight-based teasing. If that's a social thing that can happen, and that also puts people at higher risk for eating disorders.
Yeah. Yeah. Would you say that there is a pretty big correlation between adverse childhood events and the development of eating disorders?
Sometimes, sometimes not.
Okay.
I think I'll just say personally, I thought, well, if I help make sure that my child does not have high ACEs score, they will be fine in life.
Hmm.
And that what hasn't necessarily worked out for me. So yes, it can. Certainly trauma can be an issue that can cause people um, to be at higher risk for an eating disorder and for the development of an eating disorder. But oftentimes we see that there's really none of that, and the eating disorder just really still just pops up, as a way of, again, like maybe you have that perfectionistic trait. And so a lot of times people with eating disorders are incredibly good at so many things. They may be the student who's getting straight A's, and who is also the athlete who is winning state championships, and you're all of these like high functioning things that seem like they're doing really great because they have these personality traits for perfectionism. Um, but that externally everything may look like it's really good, but internally they're not necessarily, that it's not a match. And internally they're not feeling good enough. So it really is can be a variety of things. Certainly for some people, trauma is a part of it, but it is not necessary at all to have trauma in your life in order to have an eating disorder.
Oh, I think eating disorders are one of the more fascinating and confusing um, mental health diseases or issues that there are out there. It's a little bit, and it's also really tough because someone struggling with alcohol use, they can actually just stop alcohol. We don't need it to live. But
Yes.
food, we need to live. And so it can be easier to live within like the black or white, the extremes, but having
Yes,
to live somewhere in the middle is very challenging. And having that whole idea of moderation, and it's tough.
yes.
It's a tough road to walk.
Yes, it's all about, and that's why a lot of the treatment really gets into helping us to heal the relationship with food, the relationship with your body. Because it's like you said, it's not an abstinence thing. It's not like you can just go on and not deal with this. And so you got to really learn how to develop a better relationship with these things so that you can live a life of compassion toward yourself.
Compassion is such an important part of just our overall well-being in general.
Yes, it is. Yes.
How do you recommend that a family member or a friend try to help somebody who's struggling with an eating disorder?
Definitely, if you are concerned about an eating disorder, we encourage people to talk to their loved one, um, and not be afraid to just put the question aside. So, for instance, we know now that if you're worried about someone being having suicidal thoughts, that it's clear it's better to talk to them. You're not going to put the idea in their head. You want to talk to them, and it actually can help. And so, in a similar way, we really encourage people to have these conversations and to not just avoid them. Eating disorders are very, very lethal. They have the second highest rate of mortality of all mental health illnesses, second only to opioid abuse.
Wow.
Very, very high rates of death. And I mean, think about that. A lot of it is because it deals with food, so it's dealing with your body. So if your body is not getting adequate nutrition, that is impacting your heart and your kidneys and all of the your body, your physical body. So that can become fatal. But in addition, there's very, very high rates of suicide with
Mm.
people with eating disorders. About half of the deaths that come from eating disorders are due to suicide, because people do start to feel like this is my life and I'm never going to be able to live a normal life with food and have this peace.
Yeah.
And so it's really important to not just say like, oh, it'll get better or it's a fad. They'll get over it. But if you're worried instead, this is something that is fatal and life-threatening. And we know that treatment is available and recovery is possible. And the research shows that the sooner you get access to that treatment, the better, in terms of your odds for full recovery. So the research says, like, basically states like getting access to evidence-based treatment within the first 3 years of symptom onset is the very best predictor. Not to say that that's the old, that if you have been living for many more years with an eating disorder that you can't get better, but it just goes to show the value of if you see something to move on it and to move on it now. So we encourage people to think about having a conversation that might sound something like this. You might say, "Hey, Jose, I've noticed that." You're eating a lot less and that your weight has really changed and it really scares me. So you're noticing you're just providing these are things I've seen unnoticed. So you take your data points and then you share how it makes you feel. So it really worries me when I see this. It makes me scared for you. Because somebody can't fight against what your emotions are, right? So I'm scared. And then you might say something like, and so I really think it's important that we get you in for an assessment to see what's happening and see what's going on. I'm going to schedule that right now. And so you're following up with like, you're not saying I think you have an eating disorder, you're not making any accusations, but you're saying I'm worried. I'm noticing these things worry me, and we need to go and see somebody who has some knowledge so that we can really see what's happening and know what's going on. And just recognize that if you have this conversation with someone, most likely they're going to say, I'm fine. What are you talking about? I don't need to go see a doctor. Everything's good. And you should just expect that to happen because very few people want to give up their eating disorder, even if they have an eating disorder. So they may not even know they have an eating disorder. And so just expect that they're going to put up some boundaries, some walls to be like, I'm fine. And you just need to be willing to say, oh, I hope you're right. Boy,
Yeah.
That'll be
Yeah.
great if you, I hope so. I hope everything is fine, but we won't know for sure until we get that assessment. And so I'm going to schedule that for next week,
Mhm.
and just continue to be loving and kind, but also firm and really insist that you see a provider who has some knowledge in knowing what to look for,
Yeah.
and the assessments that are useful for determining if someone is experiencing an eating disorder.
Well, I know that the resources are limited in Alaska. I'd really love to share with the audience, what is Alaska Eating Disorders Alliance? What are you doing? What is it looking like these days since 2019? And then where would somebody begin if they were just like, gosh, myself or somebody I love is struggling and I really want to reach out? So kind of a lot to ask there, like what is Alaska Eating Disorders doing now? But what does it look like? I'm excited for it. I'm just excited for how much it's grown since 2019.
Yeah, thank you. So the three main areas that the Alaska Eating Disorders Alliance works in, we kind of have three main buckets. One is education, and that's
Mhm.
education for providers as well as for the community to have a better understanding of eating disorders. Even medical providers very rarely get a lot of training in eating disorders in their graduate medical education.
Right.
There's research that shows even doctors have less than 2 hours of training in this life-threatening illness. Can you imagine if you only got 2 hours of training in diabetes or cancer or other highly fatal diseases? It's wild. Um, so we do a lot of education to try to, with our providers, as well as with the general population, schools, teachers, all kinds of things. Um, the other area we work in, we work with support. So we have support groups for people, for adults who are experiencing eating disorders. And we also have support groups for family members who are supporting their loved ones. And then in addition, we do have what we consider support for clinicians and for providers, which is a consultation group that meets once a month. And it provides a safe space for providers to come in and join wherever they are in the state, since it's virtual, and come and learn more, and be able to share like cases that maybe they're like, I saw this patient and I'm not sure like how would you manage this? And so it gives this safe space for providers to talk about how they might help each other to do a better job with working with clients who either have eating disorders or potentially have eating disorders. So that's our support bucket. And then our final bucket is advocacy. So we do a lot of advocacy to try to make structural changes so that there's better access to treatment and care for people with eating disorders.
Oh, that's so wonderful. I know there's a website. We'll conclude with like how to reach out to you, how to reach out to the Alaska Eating Disorders Alliance. Kind of shifting to a little bit more hopeful topic is recovery. What does recovery look like? And you
Mm.
say a couple of times here, recovery is possible, and that's so uplifting and it's so hopeful. So, what's that like?
Well, the key is, I would say, like it's so recovery and treatment are often, they go together. And
Yeah.
so we just want people to know that treatment is available. Recovery, it's amazing to talk to somebody who has recovered from an eating disorder because they talk about it and it almost feels like, and I can say this for myself, I experienced an eating disorder when I was a youth.
Mhm.
And I look back on that time and it's like, it feels almost like it was a different person. It feels like an alien, like how was that part of my life? So you get to the other side and and all of a sudden you have time and energy and
Mhm.
um, all the things you needed to be able to think about the rest of your life. What do you want life to be with? If you're not spending all of your time thinking about food and exercise in your body, it's like, oh, I can actually now start to think about what do I want the rest of my life to look like and meeting those other life goals. So a lot of times in my mind, that's, at the base, what recovery really looks like. But getting there can be difficult. And so we want to just encourage people to access treatment. And so treatment usually does well with a team. It's usually a team sport. Eating disorders are a team sport. You really often need a therapist involved because this is a mental illness as well, and so that therapist can really help you to manage your emotions, and to really like think about the cognitive changes that are necessary as you're making changes with your food and with your body. A dietitian who is knowledgeable in eating disorders can be a very helpful member of the team. They're going to help you do things like challenge foods that maybe you think are too scary to eat. They're going to do things like help you to get what is the food prescription that you need. We talk about like, food is your medicine when you are in eating disorder recovery. And that often means like you need a personalized prescription for food. How much food, what kinds of food, a variety of foods. And it is really the dietitian who's going to be able to help you figure out what is the prescription that you need for your food, for the amounts, as well as the frequency of how often you need to be eating. And then often there's a medical doctor that needs to be a part of this because it is a physical illness as well as a mental illness. And some patients are medically unstable due to the impacts of either electrolyte changes that can come with purging, as well as the impacts of malnutrition. And so these things can cause people to be at a very severely medically unstable spot. And so there does need to be a medical doctor who has some knowledge about these things, who knows what to look for and make sure that you are medically stable, and getting you to a higher level of care if needed, if your physical stability symptoms are not staying in a stable space.
Really helpful. And I think something that I guess I didn't quite understand, but it's become more apparent to me is that eating disorders don't discriminate, and so any age, any gender, um, any person who identifies as any kind of gender, everyone's affected, and
Yes.
it can develop later in life too. It's not just a teenager thing. It's not just a woman thing. It's anybody and everybody, and so I think that's important to keep in mind too.
It's very important for everybody to be challenging those stereotypes. We have this, we call it the swag stereotype, the skinny white adolescent girl. And
Oh,
that's what the stereotype is.
yeah,
And that is, yes, skinny white adolescent girls can, develop eating disorders, but so can so many other people.
right,
And if we are not looking in all types of people, if we're not, asking the questions, if we're not screening, if we're not doing all of those things, we're going to miss a vast majority of people who are experiencing these life-threatening illnesses.
right. Yeah. Life-threatening, and also just the amount of mental space it takes up. I've kind of gone back to that a couple times too, but it just really impairs your quality of life and your ability to truly enjoy living and doing things. If you're just so focused on what you're going to eat or what you're not going to eat or how you need to burn that off, or is this, I mean, so people, the orthorexia, the
Yes.
really preoccupation with being super healthy, like everything has to be organic and things like that, to where you're just missing out on so many other things in life.
Your life becomes smaller and smaller and smaller, right? And that's what the eating disorder does. It just makes your life seem so narrow,
Right.
and you miss out then on all of the rest of the joy that's out here waiting for you.
Yeah. Yeah, definitely. Um, if you could change one thing about the way that our culture has conversations around food and bodies, can you think of something that you would change?
Oh, absolutely. I think well, first, one of the things that I would say that is a big answer is I would say, let's not talk about people's bodies.
Yeah.
There's really no reason to bring this up. So if someone has lost weight, if your first thought is to go up to somebody and say, "Hey, you're looking great, you've lost weight," I
Mhm.
would challenge you to think about why do I think that that's something that's worthy of congratulations. It's
Right.
really possible that that person has not lost weight due to a positive thing. It may be that they've lost weight because they have cancer. It could
Yeah.
be that they've lost weight because their spouse died and they're grieving. It could be that they've lost weight because they are severely restricting food, and so when and so then and losing that weight in a way that's not healthy. And
Mhm.
so when we congratulate people or about weight loss, you just don't know what you might be secretly congratulating them on, if that
Yeah.
makes sense.
Yeah, it does.
And so that's one thing. I just for me it's like I don't why do we need to comment on people's bodies?
Right.
And so that would be one thing. And the other thing that I just would also want to change in our culture is this idea that skinny equates to healthy.
Right.
And it may and it may not. A
Mhm.
lot of people, if you have become very, very thin due to weight loss and starving yourself, are you really that healthy? Is that really what we want to be encouraging people to do? And in addition, you can be in a higher weight body and be extremely healthy and active and fit. And so I think we really need to challenge our notions with the idea that there is just one body type that can be healthy.
Right. Yeah. Because
It's
as you
just
said
simply
toward the
not true.
beginning, there are so many different types of bodies out there.
So many types of bodies, and yeah, and if we're only saying that only one type of body can be healthy, we're gonna miss a lot of things, and we might be actually reinforcing some things that are really not good in that person's life.
Right. Yeah, that makes a lot of sense. I appreciate that. Thank you. I think it's really enlightening and just so many different things that I think just don't come naturally to think about when it comes to eating disorders. They're so complex, and I don't think we really realize it until we start getting into the meat and bones of them, so to speak.
Yes, yes, exactly.
um, would you say that there are some people who are particularly more at risk or that we should pay a little bit more attention to as far as kind of being on the watch out or concern for that, for developing an eating disorder?
Yes, I do think that if you have somebody with some of these traits like that I mentioned, that highly perfectionistic trait,
Mhm.
someone who's maybe very harm avoidant, which means that, they're just always looking for just that right way of doing things and wanting to get it just having things just right. So really
Yeah.
not wanting to take a risk and seeing things as kind of unsafe around yourself. These are things that I would say would put me at high alert to be
Mhm.
thinking about questioning them. Um, and when I think I'm just, thinking especially about the folks that might be watching this podcast of functional medicine. I think about specific people who might be coming in to see you who might be actually having like orthorexia and like thinking that there's just like a very specific way of being healthy, and
Mhm.
but it's becomes obsessive to want to be healthy. And whenever we're getting obsessive about something, even if it seems like a good thing to be obsessive about, it's usually obsessiveness is not something that is a positive thing in someone's life. It is not a happy place to live.
Right. Yeah. Yeah, and what something I try to share with folks who are speaking with me about overall health, eating disorders, and just come in for wellness is that so many things that we think are good for us, like these cleanses and fasting and things like that, can really disrupt the hormones. It can really impair the microbiome of the gut.
Yes.
And so they can actually be really harmful. And so it's just really just a great idea to really check the data that you're receiving and ask
Yes.
yourself, like, what am I doing this for? And is this really going to be overall very helpful? I mean, time restricted eating has its place as far as healing the gut, but it can also be harmful. So you just have to be really careful.
Yes, yes, and really think about like, okay, like let's then do some checking before we start to say, for you as an individual patient, is this going to be something are you the person that this could be helpful for, or are you the type of patient that this could be something that is harmful for?
Yeah, and close follow-up and surveillance, just checking in on a fairly regular basis and how are things going? What's it looking like? How's your quality of sleep? How's your social interactions going? Because so much of what happens with an individual in an eating disorder affects everything around them. They're not like, spending time with friends. They're not sleeping very well because they're undernourished or their body's under a lot of stress, so their
Absolutely.
cortisol's just spiking.
Yep, yep. There's some studies that show that the average person who's checking in for a residential treatment center for eating disorders often is like 3 to 4 hours of sleep a night. It's just
Wow.
because because they are just so anxious and so stressed, and that cortisol is so high that the amount of sleep that they're getting is just really, really low.
Wow. Yeah. Um, I would really love to know, for those who are listening today, for our audience, who I really thank for joining us today, what is a message that you would like the audience to carry away with them after we conclude our meeting?
I would love for people to remember that eating disorders are serious, but they're
Mhm.
treatable. And so that's serious. When we know they're serious, we don't ignore them, we don't put them aside. We investigate and we ask the right questions. Treatable means that then we're helping make sure that they're getting connected to the right kinds of resources.
Mhm.
If you have an eating disorder, you're going to need very specialized care. You're going to need not just any dietitian, but a dietitian that's been trained with eating disorders, because the kind of nutritional support that you need is going to be different than somebody with like diabetes or some of the other things that a dietitian might be called in for. So
Yeah.
I would just love for folks to leave here remembering that these are serious, but they
Mhm.
are treatable. Recovery is possible. And especially if you're a provider, you can be the person that helps connect somebody to the right kinds of resources.
Yeah,
You
that's
can
so
change you can
important.
change their life by making sure that you are following up and making sure that they're connected to resources.
Yeah. And also examine the lab abnormalities that occur, and
Yes,
just keep an eye on the different body changes. Like we've got to be really mindful of the heart and then bone density and muscle
yes,
mass. So
yes,
I
yes,
am so blessed to be in the position that I am as a provider, to be able to be looking out for these things and to identify them as concerning and something that needs to be treated, and then also offer a message of hope. And I really appreciate you just going back to those themes during our visit today. It just fills me with a lot of hope, and it reminds me that they are really serious and they need to be addressed.
yes, yes.
Where
Don't
can
don't just
people,
ignore them.
pardon?
Don't just ignore them.
Right. Yeah. Yeah, absolutely. It doesn't help anything. Where can people find you and the Alaska Eating Disorders Alliance?
Sure. So I would love, if people can find us online at akeatingdisordersalliance.org.
Okay.
And we've got some great resources there, including providers who are treating eating disorders in our state. If you happen to be one of those providers who is treating eating disorders in our state and you're not listed on our website, we'd love to hear from you.
Okay.
Really, the point of that list is just to find people who are doing this work to make it easier, so that when someone decides that they want to get help, that they aren't having to then go do that search, and to try to find who are the right kind of people who have knowledge of this. So folks can find us online and come check us out, and get involved in being part of the knowledgeable community who is helping to take away the stigma of these illnesses. And a lot of that can be done by learning more.
Yeah. Yeah, you have a social media presence as well. Don't you have an
We
Instagram?
do.
Speaking of cleaning up your Instagram.
That's right. Yes. So certainly Akita is on Facebook and Instagram, LinkedIn, and I think X, although I'm not sure where we are with our X presence right now. But definitely folks can follow us along. And we try to provide information about conferences that are coming up, or Project Echoes, where people can come and get free continuing education credits
Mm.
while learning about eating disorders, those kinds of things. And sometimes it's community events, things for parents, maybe to help you as a parent learn, how can I change the way that I talk about food and body so that I maybe decrease the risk for my children,
Yeah.
those kinds of things. So people can certainly follow it along on social media as well. They can also come and sign up for our newsletter. And we send out newsletters several times, usually about every other month. And so folks can learn more of that and stay in touch that way as well.
All right. It's really exciting to hear about those on the support groups too that are virtual, available
Absolutely.
virtually. So you you can sit in the comfort of your home, and then you've got that as well too. You don't have to risk driving in Alaska to get to the support group.
That's right. That's right.
Yeah. Well, I thank you so much for your time today, and I really appreciate it. And I hope that anyone who's interested today or anyone who feels moved by this conversation reaches out to the Alaska Eating Disorders Alliance.
Thanks for having us, Heather. Really appreciate it.
Me too. Thank you.
Thanks for joining us for the Seaworthy podcast. Seaworthy exists to help people overcome their health challenges and be fully vital. If you think we've earned it, please consider giving this podcast a like, subscribing, and giving us a 5-star rating on the platform of your choice. Thanks.